everyone, it's Lorie Brown from empowerednurses.org and yournurseattorney.com. And welcome to COVID-19 Survival Guide for Nurses and Other Healthcare Professionals. And today's special guest is Shelley Brown. And Shelley is a mindfulness facilitator, and she has a passion for rock music. So when you have a passion for something and want to incorporate it into what you do, she has learned a way to incorporate rock music into mindfulness. So I'm so excited to speak to Shelley today. Welcome, Shelley.
Thank you. It's an honor to be here. Hi, everybody who's listening and watching.
And we also have a big reveal at the end of this session, so stay tuned till the end, and you'll get gonna hear a really fun fact. Okay. So, Shelley, what is a mindfulness facilitator?
Thanks for asking. So a lot of people call themselves a mindfulness teacher. I don't call myself a mindfulness teacher because I really think that mindfulness is an invitation. And so a mindfulness facilitator is somebody who invites people to explore the practice. And you don't, if you call something a teacher, it means that somehow people are going to be taught, like you're going to get a certificate, like, oh, I'm mindful now. But I don't believe that. I believe that I extend an invitation to explore the practice, and it's really up to the individual if they are going to RSVP.
So maybe we should start with what is mindfulness? Some people listening may have never even heard of it.
Yeah, so mindfulness is very mainstream, but there's a lot of confusion. So I really appreciate the question. Mindfulness, in the easiest definition, mindfulness is really be here now. So what we're talking about is the awareness of this present moment. And practicing mindfulness is noticing when our minds have drifted to somewhere else, our feelings, our thoughts, whether we've gotten distracted by sounds or anything from the senses. And then we notice that and we have a choice and we come back to this moment.
And that's so interesting for nurses, because as nurses, we're bombarded with new data pretty much every 5 minutes. And we have to make a decision in that time about, okay, what do I need to attend to first? And we're constantly reorganizing our priorities. And sometimes when we're doing a task, we are thinking about what's ahead or thinking about our past instead of what's really happening in the moment.
I can totally understand that. But I also think that as a trained professional, you are focused on what needs to be done right at that moment. There's no such thing as being able to think about two things twice. So, you know, given the fact that people are experts in this field and highly trained, they are present. Even if their mind goes off for a second, it's not like you get pulled out into this loop of somewhere else. You know, you almost by default are mindful because you notice that you have to do something else, but you are coming back to focusing, even if it's a microsecond.
Okay. So what can nurses do to be more mindful, like when they enter work, to leave their problems at home, and when they leave work, they can leave work at the hospital?
Well, obviously, given the circumstances, I think the latter is the more difficult, which is leaving the hospital when you go home, because there's just so much uncertainty and so many things that nurses are having to deal with. And I just want to say a quick thank you to everyone in the front line of this horrible crisis. In terms of leaving home at home, because obviously people have parents and they have family and they have concerns, and coming to work, you know, it may be even just a 5-minute breathing practice. It may even be, you know, just 1 minute, taking 4 deep breaths to come into the present. I also think it's not as hard for nurses in crisis mode to have to deal with what's right in front of them. And, you know, obviously, except for the fact if there's some critical things going on at home, I still believe that many nurses come to work knowing this is my job, this is what I have to do. Conversely, leaving all the crises that are going on at work is more critical for the well-being of a nurse to come home and be able to actually find some peace. Even sleeping, I can imagine, is an issue, because what's happening is the central nervous system is completely on emergency alert.
Right.
And over time, what happens when we're in this emergency alert response, and we're talking like 12 straight hours of it,
Yeah. Yeah.
we go into this automatic response. It's like our wires get crossed, and we have a central nervous system response because all day long we are in fight or flight mode. Everything is coming through the amygdala, and everything is an actual threat.
Yeah.
So you are constantly reacting in a way that we don't have to react all the time in normal life. So implementing a practice that helps bring that presence back to the forefront is really critical for well-being. And it is a practice. It's not, oh, I'm just going to decide that I'm going to be home and that I'm going to sleep and that I'm going to take care of myself, because your wires can get crossed in that fight or flight mode.
Yeah. Yeah. And Shelley referred me to this class that I took at the hospital near me called Mindfulness-Based Stress Reduction. And in this time, I'm so glad that I had that training to remind me of the practices.
Mm-hmm.
So I was going to say, so what does mindfulness have to do with rock music?
Well, that's a great question, but if you don't mind, I'm gonna interject something really quickly.
Sure.
This doesn't mean that you have to sit in lotus position with your fingers like this or like this. Mindfulness, whatever the practice is that can bring you to the moment, it could be journaling, it could be a gratitude list, it could be an alarm on your phone on your days off, an alarm on your phone to ring every hour to remind you to take a breath, because what we're trying to do is continually extend time in the present. And so practicing that noticing muscle is what is needed to learn to extend time in the present. So what does rock music have to do with it?
Yeah.
So because so many people are not really sure what mindfulness is, I came up with a way to make it very, very approachable using our universal language, which is music. So would you like to check out how I approach this, Lorie?
Yes, absolutely.
So I'm going to ask you to go ahead and lower your gaze or close your eyes, and as best you can, I'm just going to ask you to take the next few seconds and listen. Now go ahead and open your eyes. What did you notice?
All the different instruments, and I was trying to remember what song it was and I couldn't remember.
Oddly enough, it's Give Me Shelter, which is ironic right now.
Yeah, I knew I had heard it before. I knew it wasn't the Beatles.
Okay, great. So there's an instrument, it's called the guiro, and it is a percussion instrument that has ridges, and it makes a sound that goes ch, 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 ch. Now I'm going to ask you again, I'm going to invite you to close your eyes or lower your gaze and see if you can hear that instrument, and try to keep your awareness as best you can on that instrument, okay?
Okay.
Perfect. Now hopefully I won't get a cease and desist from the Rolling Stones. What did you notice?
um, I definitely heard it. I was able to concentrate on it and separate it out from the other sounds.
Great. So it's almost like the other sounds may have become the background, perhaps.
Yeah, yeah. When I didn't notice it the first time.
I'm going to invite you to listen one more time. And if you get distracted by thoughts in your head or by hunger or anything else, note it. Note what it is. Thought, Mick Jagger, and then keep on seeing if you can bring your awareness back to that instrument, okay?
Okay.
This is the last time. What did you notice this time?
I could hear the instrument, but I could hear the other ones as well.
So you just practiced mindfulness. What we did was we anchored our awareness on that instrument, the guiro, and that guiro represents our present moment. It's the conversation that we're having. It's the patient that we are dealing with. It's the child that we're speaking with. It's anything we're doing in the moment. And just like life, that song is kind of a microcosm of life, right? We have distracting thoughts, we have feelings, we have sounds, we have children, we have dogs, we have a million different things vying for our attention. And so the practice of mindfulness invites us to notice when our mind has wandered and come back to the present moment or that instrument. Or in meditation, the object of the meditation is oftentimes the breath. And so all we're doing, a lot of people think you're not supposed to think when you're meditating, and that's not true. We're alive and we do think. But the more that we can exercise the muscle of noticing and coming back to the present, the more we exercise that muscle, the stronger it gets. So that in real life, that's the formal practice meditation. The informal practice is life, right?
Yeah.
Practice noticing, the more we can come to the present again and again.
So one of the things I learned in the mindfulness-based stress reduction class is we would have like little dot stickers and put them all over to remind us to take a deep breath. So do you think it would be helpful for nurses, like every time they enter a patient room, to take a deep breath?
We call those triggers. And so anything that you can use as a trigger, and it's usually something you do often. So if you're at home, it may be when you pick up a glass of water, or at the hospital, something that you know you always do, you entering a room, maybe that's a trigger to take a really deep inhale and deep exhale, even before you open that door. Less than, I know time is of the essence, but everybody does breathe. So taking just a little bit more time to take a deep inhale and exhale with those little triggers is really important. And when you're not working, I say structure the heck out of your day and have all kinds of triggers for all different kinds of practices, even if it's just getting up and inviting movement. When you feel stressed, one of the best things you can do is to disseminate that concentrated stress kind of congestion. Usually we feel it in our head or our chest, or we might shake. And if you can get up and invite movement, just shake around or dance or something, it will help take that energy congestion and release it throughout the body.
Mm-hmm. So can you explain the physiology about why those deep breaths help and what they do with your body?
Sure. So the stress response, and your nurses will know this better, it's what's happening is there's a release of those stress hormones when we're in fight or flight. Or look, we're all faced with all these fears, whether they're real or not, whether it's fear about the future, whether it's uncertainty. And what happens in our body is we have a surge of cortisol and adrenaline, and the dopamine and the serotonin, the happy hormones, are decreasing. And typically there's just a congestion of that cortisol and adrenaline. And so when we can move and when we can ground, when we even feel our feet on the ground, if you can even bring your awareness right this moment and feel your feet on the ground, it literally takes that congested adrenaline and cortisol, and it just gives oxygen out of the body. Even just standing up from a seated position and raising your arms up can make a big difference.
Great. Thank you. So do you have any other tips that might help nurses during this stressful time?
I do. And the biggest, I would say, is the mindful practice of self-compassion. All of us, nobody is immune to these moments of stress, to these moments of sadness and anger, whatever it is that we're feeling. And the most important thing to remember is it's okay to just allow it. It's okay to take that moment and practice kindness and not judgment. And also to realize that this is a universal suffering and that you are not alone in this at all. That's the most important. When we feel like we're alone in something, it makes that suffering, it makes the thought of what we're going through worse. And then really recognizing what does that sadness most need, and if you can self-soothe, whether it's even just a touch to your heart, and just recognizing this is a moment, and I'm right here, I'm right now, whatever you can do to self-soothe in that moment, or call a friend, or listen to music, or journal. So every day I have a bunch of different things that I do for my well-being. And every day that I do those, I know that I can show up better for others. And they include silly things like singing a song. I go on YouTube, I sing a song along with the lyrics. And by default, I'm present and it makes me happy. So anything that you could do several times a day, set the intention at the beginning of the day and see if you can accomplish those things for your own well-being.
That's great. That's great. Well, thank you, Shelley. Thank you so much for being here. And now for the big reveal. Shelley is actually my sister, and I'm so grateful to have her on this program. I think I'm so proud of her that she has found her passion with this mindfulness and now facilitating it primarily for like conventions and hotels and the event industry to teach them how to center yourself and how not to be so, crazy. And I know that the class that I took that she recommended helped me a lot. So thank you, Shelley. Thank you.
Welcome. And please try meditating, even if it's 2 minutes. Get an app, just try it for a couple minutes. It's not easy, but it is helpful. And it's my honor to be here with you. Thank you.
Thank you. And to all the nurses out there and healthcare professionals, we honor you, we thank you, we applaud you. At New York at 7 o'clock in the evening, everybody's reaching outside their window, going on their balconies and applauding all of the people on ground zero, helping this community. You are not alone. We are here to support you. We love you. We're rooting for you. You're our heroes, and I thank you. So thank you, Shelley, for being here. And if you're enjoying these programs, please share them at empowerednurses.org/COVID and help as many nurses and healthcare professionals as we can to learn these. I really wanted to break it down into really simple, meaningful tricks and tips that you can do tomorrow when you go to work. You could take a deep breath at every patient's room you enter. It's simple, it's easy, and it will lower your stress response amazingly to increase your immunity and help you get through this. So thanks, everyone. Bye.